Hi, everyone, and welcome to the mini lecture for the chapter on nicotine. And as you probably know, we live in Kentucky. Kentucky is a tobacco growing state. So there's a picture of a farm in Kentucky growing tobacco plants. And smoking is also very high in Kentucky. So this is a very relevant chapter to our state. So if you actually look at demographics, Kentucky, 1 in 4 people in Kentucky in the adult population are current cigarette smokers, so 25% approximately. And smoking does vary from state to state. Kentucky is 49th among all states for smoking. So oftentimes we are considered to be a state that not only smokes a lot, but has a lot of health conditions associated with these high smoking rates. So we'll come to that in this chapter. So a little bit about nicotine. So remember, smoking is ingesting the tobacco plant with a lot of other chemicals, and nicotine is the main psychoactive chemical that is a stimulant drug. So it is the third most widely used psychoactive drug after caffeine and alcohol. Like caffeine, it's a plant-based alkaloid that is a stimulant drug. And if you ingest large amounts of nicotine, it's toxic. So it is actually used as an insecticide. So, people who work on farms sometimes use nicotine, and they must be really careful about using it, because if they touch nicotine with their bare hands or by accident get exposed to a whole bunch of nicotine through their skin, they actually can get incredibly sick very quickly. So for sort of contextual reasons, that doesn't happen too often. The lethal dose is actually about 60 milligrams for nicotine. And when you're looking at somebody smoking a cigarette, they're ingesting about 1 milligram of nicotine. So there's a picture of the tobacco plant. And the tobacco plant, it's the leaves off of the plant that are cured and prepared in various ways for tobacco products. The cigarettes is probably the one that's most common, but then you also have cigars and pipe tobacco, and some people chew tobacco, and there's different possibilities. If you drive around in Kentucky, especially in the agricultural areas, you'll see the leaves of these plants bundled together on the backs of trucks after harvesting time. So if you've never actually driven to some of our more rural counties, you don't have to drive very far south of the university, and you will see this. So it's kind of a neat thing to see. And I've actually had students in my lab who have invited me to come see their parts of the state for various reasons. And I'm always impressed at how green the tobacco fields look, and then how much of the agriculture is still tobacco. So it's sort of something interesting to think about for our state. It's still a very important agricultural product. So when you are ingesting nicotine, it's mainly inhalation that is the large route of administration for most users smoking. Okay, so the nicotine is vaporized into tiny particles, and then the psychoactive drug is going to be absorbed by the mucous membranes in the lungs. And so this is a very fast and effective way for nicotine to reach the brain very quickly, which is partly why it's so addictive. It's not the only way you can ingest nicotine. Of course, I already talked about by accident, it can go through your skin. The skin is a pretty good barrier for most things, but it will go through skin. And so someone who is exposed through the, in a farm setting, it could happen that way. Not very common though. But through the skin also, transdermal is the way we use a nicotine patch for someone who's trying to stop smoking. They might want to use a nicotine patch by releasing small amounts of nicotine through the skin. And then intranasal is another way. So for anyone who uses a nicotine nasal spray or snuff, that's intranasal. So when we think about nicotine and the acute effects or the short-term effects that the person experiences, it is a biphasic drug where low doses will cause stimulation, central nervous system stimulation, but if the dose gets far too high, it actually reverses, and the effect is no longer that mild stimulation. So when people do studies, first of all, the biphasic effects of the drug make it tricky to do studies. And then also there is the consideration of, is the person a regular smoker or not? And you probably remember that from the last chapter on caffeine. This is the exact same issue that researchers face when they do caffeine studies. So is the person a regular user of caffeine or not? Because if you take away a drug that someone is normally using, they're in withdrawal. And this is very true, again, for smokers who are, or other users of nicotine, that if you take away their nicotine and then you give them nicotine again, you know, are you actually inducing some sort of effect, or are you actually just getting rid of the withdrawal or withdrawal reversal? So, you know, it is sort of something to think about when you're looking at research studies. What are the conditions that the subjects were tested in? And also, what is their baseline state? Are they a smoker or are they not a smoker? Okay, so with that caveat, when we know in studies it's a stimulant drug, it will do certain things. So I'm not a smoker. If I used nicotine, I'd probably have some of these findings, like improved attention. My short-term memory, my working memory would be a little bit better. So if I had to remember a phone number that I wasn't familiar with, I'd be better at that. Recognition memory, reasoning, information processing, how quickly I'm thinking, essentially. How quickly can I learn new information? Even just like finger tapping speed, which is a measure of just fine motor control. All of those things are a little bit better because this is a stimulant drug. Okay, and it seems to improve both simple things and complex things in thinking, or simple and complex things in cognitive processing. So this is the immediate effect, the short-term effect that you get after maybe only one dose. How do you feel? Well, as a stimulant drug, you also feel positive things like pleasure, feeling good, energetic, liking and wanting the drug again. Sometimes smokers will report things that smoking is relaxing and decreases stress, but a lot of times it's hard to determine if that's actually an effect of the drug or if that's the way the person typically uses the drug. So if you're a smoker, you typically take a break, especially nowadays, you can't smoke inside or on the workplace. So you probably leave your workplace and go and smoke and take a break for 10 to 15 minutes. And so they're pairing the experience of relaxation with the smoking. But if you actually try and disentangle those other factors, if you actually just look at what the drug is doing to a person, it generally shows that it's stimulant effects. It's not really causing relaxation. It may actually increase a bit of tension and jitteriness because it's a stimulant. On the body, the stimulant effects stimulate the sympathetic nervous system, your fight or flight response. So you'll see mild changes like increases in heart rate, a little bit increase in blood pressure. Your breathing, your respiration might be a little faster, maybe a tiny bit of sweating, increased metabolism. So a lot of smokers, they don't tend to gain weight over time. They tend to stay at a lower body mass index, and that's because of those effects on metabolism, both at rest and while exercising, and it does tend to slow digestion. So one of the things that's a big challenge for people who have developed an addiction to nicotine and then they try and stop smoking is not only are they grappling with the addiction, but then they also are grappling with weight gain. Because that comes with not using the drug anymore. Now, the lethal dose up to 60 milligrams for adults, 10 milligrams for children. A lot of times nausea and vomiting will occur from smoking and before that overdose point hits. So that nausea and vomiting, especially for someone who's never smoked before, it may only take one cigarette to induce that effect. It is a toxic drug. And so you will see those responses in people, and that is sort of protective. It is a toxic compound. Nicotine replacement products can also lead to accidental overdose, but this seems to be fairly rare. A lot of nicotine products, they're lower doses or their mode of getting the drug into the body is rather slow, like the nicotine patches. So nicotine as a stimulant drug is very reinforcing for humans. It's a good reinforcer. Animal studies have also been shown to demonstrate this effect. So in the chapter, you'll see examples of conditioned place preference, self-administration studies, and conditioned taste aversion studies to look at how nicotine is a reinforcer. So you can look at those 3 different methodologies in the textbook and take a look at how, those different studies are done to show this. And generally, all the studies are showing is that it doesn't matter the methodology, nicotine is rewarding, and sometimes it has some aversive effects too, especially if the dose gets higher, it's toxic and it makes you nauseous, right? So that can be aversive. So the dose matters. Okay. So tobacco use, as I mentioned before, that nicotine is one of the compounds in tobacco, in the tobacco plant. When people are smoking, they're not just ingesting nicotine, they're ingesting all the things in the tobacco plant. And the Surgeon General states that there's no safe level of exposure to cigarette smoke. We know that nicotine alone is addictive, but it's actually not really associated with significant disease. So when you think about smoking and cancer, it's the other things in tobacco that are leading to cause cancer. The carbon monoxide, the tar that is in the cigarettes is also very harmful for health. So you could theoretically ingest nicotine regularly, it would be very addictive, but it wouldn't lead you to have serious like lung cancer problems or something like that. Okay, and so the actual smoking of tobacco, the use of tobacco, also like snuff or chewing tobacco, things like that, all of those uses of tobacco are, it is combined a leading global cause of preventable death. So 6 million deaths per year due to tobacco use, and cancer, cardiovascular disease, pulmonary disease. These are all the things that are completely preventable if people weren't using tobacco products. It also has some negative effects on reproduction as well. And so that's in the chapter, a little bit more detail if you want to look at that section. So clearly we don't really want people to start using tobacco products because of all these things that we could prevent. So when someone uses tobacco in a tobacco product, they're going to develop tolerance quickly. And we can even see this if you give nicotine by itself in the lab without the tobacco products. Those initial nausea, unpleasant sensations, those go away very quickly. You develop tolerance to those. And so as a result, people become physically dependent on nicotine very quickly. And so once you become physically dependent on nicotine, if you suddenly stop taking nicotine in any form, you're going to get withdrawal symptoms very, very soon. And some of the symptoms are annoying, like craving nicotine or smoking, irritable, anxious, difficulty concentrating, restless, increased appetite, impatience, but then some of them, it can differ. Some of it's more like you feel pain and you can't sleep. And so all of these symptoms combined are very unpleasant, and it's very difficult for people to stop smoking because all of these symptoms make it difficult to feel well, to work effectively, to not be difficult to be around because you're so irritable and grumpy and things like that. So those withdrawal symptoms, if you've ever been around someone who's tried to quit smoking, you know that they're significant. Okay, so how is nicotine acting? What's going on? So, we have this neurotransmitter acetylcholine, and nicotine stimulates acetylcholine receptors, causing increased release of acetylcholine. So that's one thing that's going on in the brain. The other thing that's going on in the brain is that it also raises dopamine levels in the mesolimbic dopaminergic pathway, which is the reward pathway in the brain. and is very much associated with addiction. So we talked about this in the second chapter. This is this addiction pathway that natural rewards release dopamine in this pathway, but drugs of abuse oftentimes release much more dopamine. And so those two things are going on. Now, acetylcholine is interesting, and the action of nicotine on acetylcholine is actually something that individuals who are scientists who are interested in this area have been studying. Because what we have learned is that aside from the health problems with smoking, if you look at nicotine in isolation, nicotine may actually be useful in various medical conditions where you have impaired cognition as a concern. So this is a picture from the University of Kentucky Tobacco Research Center. So conditions like Alzheimer's disease, where you have problems with your memory, or Parkinson's disease, where you have problems with motor movement. These are degenerative conditions that often occur with older age. And these are conditions where a lot of times you will see impaired cognition. And what we know is that nicotine potentially might be useful in these various medical conditions. Part of the medical uses of nicotine emerged because of observations. So being a good observer allows you to discover some important new findings, at least start the process of doing studies. So if you look at people who have the mental disorder of schizophrenia, where they have experienced delusions and hallucinations, if you look at patients, 80% of them are smokers. They smoke cigarettes. So compare that to the Kentucky rate of smoking of 25%, and that's really high compared to the rest of the nation. This rate is like off the charts, very high. And when you look at individuals who have schizophrenia, if they are smoking and they smoke a fair amount, they will report improvement in their symptoms. So observant clinicians observed this and then started reporting this in the literature. And so they started looking at nicotine as a therapeutic. So not giving people cigarettes to smoke, but isolating the nicotine and then giving nicotine to individuals to see if it's useful. So this is a chart from the National Institute of Health, and it looks at some of the things that have been really positive about nicotine, and then maybe some negative things. So negative first, obviously negative things like it can cause, gastrointestinal distress, like nausea, vomiting. It can cause hypertension. It can cause seizures. So lots of negative things about nicotine, even by itself. On the positive side, though, it routinely in studies has shown to, enhance cognition, make people think faster and more clearly, and help them in any aspect of mental processing of information. It has cerebral vasodilation effects. So therapeutically, looking at the blood vessels in the brain, nicotine might be helpful. Neuroprotective effects in the brain. It can help with pain, so analgesic effects, and clearly antipsychotic effects. So this is coming from those studies with schizophrenia. And actually reducing anxiety. So there's all kinds of things that are positive that make you think, well, okay, tobacco by itself may not be the best thing for people. Smoking may not be the best thing for people. But, are there things, if we isolate the nicotine, that would make it useful? And so in this case, it may be worthwhile to consider, not banning nicotine as all negative, but looking at it in isolation. Is there something useful medically for that psychoactive drug? Okay, so that's it for this mini lecture.